All right, guys. Listen, great to be here tonight. I'm so excited to have Allison Remy in the room tonight. And I know that Shelley is jumping off of her seat. We're going to have a great discussion tonight. It's going to be kind of an open discussion, open panel. We're going to ask some questions, get some answers, get a little bit of training. But you know what? I'm going to hand the gauntlet off to you, Shelley, and I'm going to ask you to introduce Allison, because I know you're really good friends and you have a history. I first met Allison and you together. I think I mentioned that today. And so I know you've been friends for a long time, and she's been a great asset, not only to you, but to Skip, and now, of course, to Normie serving on our medical advisory board. So I'm going to turn it over to you and let you introduce Allison.
Well, good evening, and I'm very excited to introduce Miss Allison. Allison is a CIRS trained physician. She is a PA, and I met Allison a few years ago when we were working together at the Environmental Brain Health Clinics. And she really has just taken a stronghold into all things CIRS. She's trained underneath Dr. Heyman, and just spoke with Dr. Heyman the other day. He said he's so proud to see the birds leaving the nest, as he likes to call it. So I know Allison is really just kind of taking up the baton when it comes to educating the world about CIRS. Allison, as she will tell you herself, she found out that she had CIRS in the training of going through this and kind of stumbled into it. So I don't think anyone is immune from CIRS in this world. And I think we're really just kind of pulling the veil back to how many people in this world have really been stricken by this illness. But there's hope. And I think that is probably one of the most inspiring things to come down the pike, right? Especially if you've been very sick through the years and gone to so many physicians and you get no answers. It's almost like you're being gaslit when, in fact, you do know that you're having symptoms. So I am going to turn it over to Allison and roll it out, sister. We're so excited to have you this evening.
Thank you so much, Shelley. My name is Allison Remy. I'm a physician assistant, like Shelley said. I've been practicing for 18 years. And, in that 18 years, there's always patients that stump you. And those patients, they come in with this laundry list of symptoms that kind of just, you don't know what to do with. I mean, there's so much going on. And, we tried all of our best things, all the tools that we had at the time, thinking back on things. And some people would get better. Some people would get worse. Some people wouldn't have any change at all. And, I just didn't know how to help these folks. And hindsight being 2020 and knowing what I know now, probably the majority of those folks were suffering from some sort of environmental illness that was magnifying their already existing problems. So I think that's a really huge thing moving forward. In, you as environmental professionals are you're the gatekeepers. You're the first kind of line of defense, so to speak, and that you're coming across these folks who are sick in their homes. You're assessing their homes. You're remediating their homes. And, it really is. I'm so glad for Normie and Doug and Skip and Shelley and everyone, because it really is a bridging of the two, the camps. And I think that's what it's going to take to get people better and to educate the public and to realize that this is a public health emergency. This isn't getting better. It's getting worse. I mean, and it's a national security emergency too now, with all of the problems in the military housing. Our military is supposed to be the tip of the spear, and they're sick from the places that they're living in. So, I think we just can't talk about this enough, and I think that we can't. This is just the beginning of bringing together the two camps to really form this super duo to go forth and really change the conversation about environmental health and what that means.
Boy, you could not have stated that any better. And I'm going to shout out to you a special token of gratitude, because I have referred quite a few people your way, and every one of them that has made contact with you, sometimes they don't follow it up, and it's not your fault, but those who speak with you say, oh my God, what an unbelievable experience that was. You know, for those of us who deal with these types of folks, oftentimes it's very difficult. They're very frustrated. They don't feel well. They can't sleep. They can't put a good thought into a sentence. It's hard for them to describe what's going on. They feel alone. No one believes them. And after speaking with you, they just go, oh, I feel in such a better place. I don't know what's going to happen, but at least I talked to somebody, because they've already tried to talk to their local doctor. They've tried to talk to their allergist. They've had multiple remediations over the last 5 or 10 years, and they don't understand it. And when you have that conversation, whatever it is you're telling them, they have a sense of, you mean I might have a glimmer of hope? So I appreciate that. One of the things that we're out here in Tennessee training, Doug, myself, Michael Pinto, Dr. Gavin McGregor Skinner, and we talk about this notion that for decades and decades, a mold environment only dealt with observable mold. And one of the things that Normie is doing through our elite NCRSI class is we're almost republishing that, the most noteworthy aspects of global academia findings on both the built environment and clinical. And people go, are you kidding me? This stuff has been around. And so where the rubber hits the road is when someone finally is referred to you, or you're talking to folks in your local marketplace, which is, I believe you're in Austin, Texas. Mm-hmm. What's it going to take that's our role. Is the data's been here. We have to act on it. And the point is now. And the other thing we talk about is how big the patient population is. From a genetic susceptibility, 80 million people in this country. And then mold allergy and chronic allergies and chronic exposure means that runny nose, that upper respiratory, that whatever it is, never subsides and goes away. And you can't get any modicum of consistent health. That's another 40 to 60 million people. You're talking 100 million people. It's a third of the population. And this is my passion coming out here. So Normie's kind of like this. We're rebroadcasting this stuff and telling people in the industry, this is real. So we're trying to set it up, but what's it going to take? What's it going to take for mainstream healthcare clinicians to start really recognizing or valuing the realities of environmentally acquired illnesses?
I think it's really going to take, there's a lot more data out there. And that's why I'm really thankful for the way that Normie has set everything up with Dr. Heyman and the medical advisory board, and that we're all about getting concrete data. And then we've got to basically put all of that data together and put it into, some different articles. We need to publish. Here's what we're finding, because that's what it almost takes for a lot of mainstream clinicians. I work from a more integrative standpoint. We're an integrative and functional clinic. So we're always kind of looking for that deeper root cause. But in the more kind of allopathic mainstream, which I don't knock them. I mean, there's a reason it's been around for so long, and we utilize that in our clinic. But I think that if it's not in the evidence, if it's not in the if it's not published data, then it's anecdotal and people don't pay attention, at least from a clinician standpoint. They're always going off of what is the most evidence-based practice. Well, this Shoemaker Protocol is the most evidence-based practice. It's the only protocol that has published data behind it. So, that's a huge thing too, that I always drive home. Like, I spoke in Boston a couple weeks ago on environmental medicine and CIRS. And I beat that into them that, hey guys, if you want evidence-based and you want to be practicing kind of tip of the spear, here it is. It's the Shoemaker Protocol. It's the only evidence-based protocol out there with results, published results. You know, all the other and you know, from an environmental standpoint, there's so many other different mold camps out there, but they're all it's all their evidence is anecdotally based. You know, maybe they wrote a book, but that's not a peer-reviewed book. You know, it was just published by whoever their publisher is, or Amazon or something like that. So, you know, it really speaks to getting into the thick of things, doing a literature search, and you've got the evidence right there.
You know, one of the things that we're trying to do, which I think is going to make a huge difference in this whole industry, is just to do exactly what you said, to collect the data. We are on the front lines, and we're the ones that can get the data that the medical side needs, connecting the built environment to the healthcare. Obviously, we can't, you know, deal with their health, deal with the client's health, but we can certainly show that by making the environment cleaner, their health has improved because their doctor says it's improved. So I think one of the things that has been a little bit frustrating for me, but then, you know, sometimes I stay frustrated, is that we don't have more and more normie members who are stepping up to the plate and saying, yes, I want to be a part of the solution. Can you imagine? I mean, this just blows me away. Can you imagine 4 or 5 years from now being able to say, I was on the forefront of collecting this data that changed your life, Mr. Client, so that now your wife's medical bills can be paid for by health insurance? I was part of the solution. Can you imagine? If that's not a motivator, I can't imagine what is, because most of the people that are dealing with this have very limited resources. They've already been beat up how many times by remediators, by assessors, by IAQ specialists, by doctors who didn't know what they were doing, by a husband who was frustrated. It just gets me excited to think about we are really finally a part of the solution.
100%. And, you know, Skip, you asked, you're like, you know, in the patients that I've interacted with, this is what I've told them I've just validated them that they're not crazy, that their house really is making them sick, and that there is a pathway to get better. And I think just that glimmer of hope, because I mean, you know, I think back to my husband, or, you know, my journey along with my husband, and the amount of times that, you know, before I started working for the brain health clinic and really got introduced to this chronic inflammatory response syndrome, how many times I was marginalized in my symptoms. I had no idea what was going on. They just told me it was my thyroid. And so, you know, and that was frustrating. And, you know, trying to look for other things that would work and trying different modalities and nothing working. And then within a day and a half of working at the brain health clinic, I pretty much told the owner of that clinic, hey, I think we need to do some testing because I think I have CIRS. And lo and behold, so, you know, it's that validation, honestly. And I think providing that not just from a medical perspective, but an environmental professional perspective, just all the way around, and letting those clients and patients know that we're a team, that it's not so disjointed, that, you know, this person handles this person handles that. It's we're melding together to get their house better and to get them better.
So Allison and Shelley, I have a question for you that I've been itching to ask. And I haven't really kind of figured out how to ask it until right now, I hope. So I have a friend, we have a friend who has a sister who is basically sleeping in a tent because she cannot live in a house. That she tried living in her brother's house. She tried living in a mobile home. And I think, at least the latest I heard, is that she's still in a tent. I tried the best I could to try to talk with her about options, about that we might be able to clean up the environment. My question to you is this. Here was a lady, and I just have a feeling that you've been here. Here's a lady who's lost all hope. She just has been beat up so many times that I just am convinced that there's probably nobody that she trusts. What I want to know is, what was it that turned you around? Because I'm sure you were there. What was it that turned you around and said, you know what? Maybe there is an answer. Because that's what I want to. I want to figure out how to give her hope.
I'll let you tackle that one first, Shelley.
Well, I know for me, I was fortunate enough to have my very first doctor be the Dr. Shoemaker. And so when you have a physician that listens, that can take tests and realize what's happening to you, and then you move through the sequence of detox and you start to get better. And for me, it was when I actually got closer to the end of that and I was on the VIP. I was no longer finding my keys in the freezer. I was able to make a complete sentence. I was able to remember things. That's when I was like, whoa, 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 hey, Shelley's back, right? But I didn't even realize how far I was lost. And I think that's where a lot of people get, is you get so far down into the rabbit hole of being ill. You add on to that family that doesn't understand. And that is a very profound thing that I see across the board is when you think the world is against you, you start to think that you're crazy, right? And you're like, but wait, I didn't, for me, I didn't used to find my keys in the freezer. Why am I finding my keys in the freezer now? What's going on? And for me, it is, I think, being able to supply hope to people to say, I was you. I was in the boat that you're in. Let me hold your hand, right? And walk you through the process of what I know to be as a personal testimony of what that looks like to be well. And it starts with a clean environment, because we can't get well if we're not in a clean environment, and really just reiterating those things. But there's something about, and I've said this along the way, I've been in this for 15 years now. When I meet advocates in this space that have personally gone through this, there's something about the compassion and the genuineness in their voice that comes through when they're advocating and they're helping others, because they too have been in that sinking ship. And I think it's just like recognizes like is the simplest way that I can explain it to you, Doug. Allison, if you want to add on to that, but I really think that's, for me, that's what I've got.
Yeah, I think not only that, I couldn't agree with you more, Shelley, but I think it's also from a medical perspective is meeting people where they're at. I mean, I can tell you right now, I have patients, 3 patients that are living in a tent, 2 living in a car. And there's no one on earth that is going to talk them out of those spaces at the current time. No matter if we were to show them 100% glowing, clean environment, they wouldn't trust it. So I think it's really kind of meeting patients where they're at and taking the baby steps with them of, okay, I understand if you don't want to move into this clean environment, but I will tell you, all of those folks right now also don't have a clean environment to move in. And they have met with so many assessors, remediators, cleaners who have supposedly sanitized their environments, done all fogged their places, done all kinds of things, and it's still not safe. So I think just meeting them where they're at and then trying to hook them up with normie pros, with people that understand the science and understand and are utilizing this protocol, this revolutionary protocol that kind of, that addresses everything, it speaks to the sensitized individual. So I think like I said, just meeting them where they're at and taking baby steps and realizing that this is also a visceral response that they're experiencing, that they've had so many exposures, and literally every time, and you know, it could be just from the familiarity of the environment. Every time they walk in, their body has a response. Now, it still may be a clean environment, but you can't tell their nervous system that. So that really, you know, turns into us as more so medical professionals than anything else, realizing that they're having this kind of visceral, sympathetic nervous system response, and then getting them the tools they need, like EMDR, to kind of reframe all this. And to, you know, it's kind of like me walking into the woods and I find a snake and it scares me, and you know, I keep on walking. The next time I go into that same space, I don't necessarily see the snake, but maybe I see a vine that looks like a snake, and I have that same visceral response. So I think kind of recognizing that and getting patients to reframe that through EMDR, you know, kind of retraining their central nervous system. I think it's all of that, because I think that's what I'm dealing with all those folks specifically that are living in those situations. You know, come hell or high water. I mean, it could be the coldest night in winter, and they're out there in the tent, or they're out there in their home, or I mean in their car.
Sounds like a kind of PTSD.
I think they're all
Exactly.
still
It is
stuck in fight or
100%
flight.
PTSD.
Mm-hmm. Many of them are.
You know, you made a great point, Allison, that that the group that you're treating now have gone through the ringer. They've had assessors who go, nah, there's no problem here. I did one air sample. There's nothing going on. You know, or they had remediation a bunch of times of the visible mold, and we don't even, hopefully it was done right, but there's a lot of instances where it's not. The opportunity for us as an organization, preventatively, forward thinking, that assessors will understand that they can't apply outdated methodologies, that remediators understand what biotoxin decontamination is going to solve that problem. That's a time and effort aspect that's, you know, down the road, but every day that's what we're trying to do. It is you can't look at it that way. An interesting story. One of the people I just referred to you, who I know you spoke with, thank you very much, is dealing with a landlord. By the way, this person this person's a doctor dealing with a landlord who doesn't understand this stuff. Had a different air testing company come in. The air tester indoor air testing company did not understand she was a doctor, and said, you know, the reason why you're sick, this is truth, this is real. The reason why you're sick, you know, is because it's the vitamins that you're taking.
Wow.
That's the true story.
For real.
So she says, we've not been able to go in that bedroom, and we rarely go in that bedroom. I want an inner wall cavity sample of both. Well, the bedroom that the door has been closed since the day they moved in, 2 years, 150,000 Stachybotrys.
Wow.
And this is, you know, look, we don't want to talk about assessment malpractice. And the normie professional doesn't conduct themselves like that, hopefully. But there's a world of upside opportunity here, such that never happens again. And thank goodness that you know, she's got the right temperament to deal with something like. She said, actually, you know, I am a doctor. Would you like to repeat that so I can record it? There's a tragic aspect to this. It's the Wild West. So much of this it's not regulated so much. And really what it's just going to take people who understand that there is a place to go to. And our effort at the national level through our medical advisory board, I can't say enough for you and the others that have accepted an invitation to be really the thought leaders in this industry, to be the ones that are welcoming the alignment of environmental professionals to the clinical realm, Because the other thing that we talk about, and we spoke about it today during our testing, and I know this is going to be music to your ears. The remediation, basically, in essence, simply stated, what I just said is the remediation industry, by and large, does not understand data, evidence, standards, and controls. And yet, that's the world in which healthcare providers live in every single second of every single day. And that's where we're at with Normie. It's all about data, evidence, standards, and controls. How do you see that similarity? You operate on that. There's a way to put a blood pressure cuff on somebody. If you're going to have vascular surgery, then every scalpel has to be autoclaved. It has to be documented. It has to be tested. If you're going to make an incision for that vascular surgery, there's a way and process to do it. How long overdue in this? And is this in the industry? And how much more can we get, the medical advisory board to start shouting about, hey, look, these guys are doing it right?
100%. I'm shouting all I can because and that's what providers need. I think when they are trying to search out environmental professionals that they can send their patients to, they want to know that there is a process, there's a protocol, and that it's evidence-based, which is boom, Normie and the NCRSI protocol.
Yeah.
I mean, it's simple. Nobody else has this. This is the way forward. And I think that also brings a lot of peace to the client, to the patient, in knowing that, hey, the protocol they're doing on my house is a universal protocol that's standardized and speaks to me and my genetic susceptibility, and is going to make sure that my residence is safe. And it's not Joe Schmo over there just saying, yep, looks good, smells clean, you're good.
Well, one of the cool things that we had a great reaction today in the class, because this is going to be a great group of people to help us with our network. But anyway, one of the things that we said that just they all said, yeah, that's fantastic. We said when we contract, when the service provider network contracts with a client, the first thing they get after their invoice and their contract is a copy of the level 4 protocol. We want it to be in their hand. We want them to know exactly how the work is going to be done, and we want them to tell us if it isn't.
Exactly.
And what's so funny about that is I was thinking about this the other day. Can you imagine any remediator on earth handing a customer the S520? It doesn't happen.
No.
It just doesn't happen. So I think it's so cool because what I think is going to happen is as we build this network, having that kind of accountability, standardizing the process, making sure that we're getting the information we need for you guys, for the medical advisory board, it's absolutely changing the industry.
100%. 100%. I mean, I want to get that into the hands of every patient, every provider, anyone who says, hey, I think I might be seeing a patient that's affected by a biotoxin illness. Great. Here's the NCRSI. Here you go. Know this, love it, embody it, and we can hook you up with a professional to carry that out.
I think you just created a new tagline. Normie Pro Management, the physician's choice for biotoxin decontamination, or hire the looks good, smells good, no mold problem guy.
Exactly.
Allison, we have a list of questions coming in on our chat. The first one says, do you have a list of medical issues that are caused by mold and other microbial issues?
Yes, the list is extensive. So biotoxin illness literally touches every system in the body. And so this is kind of why biotoxin associated illness, it's this great masquerader because it can manifest. It's going to manifest for every single patient in a different way, shape, or form. No one person's CIRS journey is like the other. So, I've got people who their only symptom is body aches. Literally, that's it. Everything else is fine. They just have body aches. But then I've got other folks who have the brain fog. They have body aches. They have joint aches. They have word recall problems. They have problems with their bleeding disorder. I mean, anxiety, depression, mood swings, you name it. There's not one system that goes untouched in the body. So, and the other thing about biotoxin illness too is that what you have to understand is that when someone gets exposed and has this genetic susceptibility, or they're under an extreme exposure, that even for someone who's not genetically susceptible, they're still having symptoms. I mean, it's so invasive. So the symptoms are they're all over the place. So I would love to say that, oh, it's going to be this, this, and this every time, but it's not. I mean, it's different. It's different throughout. And it magnifies whatever illness was already present. So if someone already had hypertension or autoimmune disease or another kind of syndrome, could be anything. If they're exposed to biotoxins, all that's going to do is magnify it and make things worse. And so that's where we really look to see, from a dysregulation standpoint, that's where we really look at blood work to see the extent of the dysregulation in the innate immune system, which is the immune system that we're born with. Because that's really what the problem is at the core of this. It's the fact that the two parts of our immune system can't communicate with one another in the genetically susceptible individual. So what happens is the immune system we're born with, the innate system, just keeps that biotoxin, and it creates this cascade of inflammation that just keeps going and going and going, and it goes unrecognized because a majority of our traditional labs in medicine look at the adaptive immune system, which is the immune system that grows with you and learns what things are good and bad. And when there is something bad that the body's presented with, it takes care of the infection or the insult, creates memory cells so that it remembers that this is a bad thing, and then goes on about its business. So that's why, I would love to give you a list of every single symptom, but there really is none, because there can be anything. But we can give you, we do have a symptom questionnaire. There's 37 different symptoms that we ask about that I think it would be good for you all as environmental professionals to have an idea of, do you have problems with fatigue, body aches, a metallic taste in your mouth? Do you get static shocks? All these different things, these 37 symptoms, they cover, a lot of the different body systems. So just being familiar with that. And then, when you listen to people and just asking pointed questions, what happens when you leave your home, the potentially affected residents? Do you get better? If they answer yes, they say, oh yeah, I had a patient I talked with the other day who's onboarding with us. When she leaves the environment, they feel better. She's like, almost all my symptoms go away. But then when I come back, it all comes rushing back. Well, that's a big red flag right there, that's a biotoxin illness, and that their home is making them sick.
Shelley and Skip, Allison just gave me a fantastic idea. Maybe that list of 37 things could be sent to the leads after we do our intake interview as a free resource. We're sending to you, rather than asking them the questions, because that might be a little embarrassing, but say, hey, as a free resource, we want to provide with you a list from our medical advisory board that shows some of the symptoms that people are experiencing as a result of this issue. I think that would be really cool, because it would then significantly substantiate to them that, yeah, this is real. This is me.
That would be
Absolutely.
that would be easy to do. what I could do is just modify a patient symptom questionnaire of how I ask them about their symptoms and really kind of adapt that more to a patient forward handout that kind of explains.
What a great idea. I
Yeah.
love it. I'm not just because it was my idea, it's your idea.
All right, next question is, where can people find medical professionals in their area who are knowledgeable of these integrative medical protocol for sensitized individuals?
That's a great question. So, just like environmental professionals, um, medical providers are not all created equally. So, I think probably one of the first resources I would go to would be to probably the Surviving Mold website, where you can find a Shoemaker proficiency partner. Um, And then I would ask them a series of questions, because there are a lot of providers that say they're Shoemaker trained, but when it gets right down to it and you ask them about the protocol steps, they tend to go rogue a little bit, or they go off on their own, and then they maybe come back to this, but then maybe they add in that. So I think it really just is questions, asking them, or getting a referral from us. I can tell you a handful of providers around the United States that I would feel comfortable referring people to, that I know are taking the tenets of the protocol and staying true to it. Because I mean, that's part of it too. Is so many of these other different mold camps have taken parts of the Shoemaker protocol, but then they go off and they create a whole nother protocol that, again, we have no evidence that it works. There's anecdotal evidence, but there's no data that tells us how well does it work, or does it even work.
Do you think that's going to change when the GW starts teaching this on a broader scale?
Yes. I think the more that we can point people to a continuing education based major university platform that is teaching this, I think that's gonna change the whole ball game in terms of more mainstream providers seeking out the information and getting trained, because they're seeing these patients already. Some of them just don't know it. Some know it and they don't know what to do with it. They don't know what resource to go towards to get that information.
Yeah. Yeah.
All right. Looks like someone said, I like to look at the ISEAI website, the International Society of Environmental Acquired Illness. You would need to ask about a Shoemaker protocol. Can you tell us a little bit more about that?
Repeat the question.
It says, someone said, I like to look at the ISEAI website, the International Society of Environmental Acquired Illness. Would you need to ask about them about a Shoemaker protocol?
I probably would. I would see, kind of, vet them a little bit and ask them, what is their protocol in treating mold? Do they look at a genetically susceptible individual? Because that's the other thing that I really love about the Shoemaker protocol, is it concentrates on the genetically susceptible person. Because if you think about it, okay, 75% of the population is not genetically susceptible. So if they get an exposure, they may come to you and say, boy, you know what, I got exposed at a home or an Airbnb or something like that. I'm not feeling great. And you can hit them with glutathione and maybe some other detox, a little activated charcoal here and there, and they get better. But it's that other 25% of the population that you do the same thing and there's no improvement, or they get worse. So I really think it one of those vetting questions is asking, do you delineate between the sensitized, genetically susceptible individual, and do you treat to that? Or do you have a generic protocol that you apply to everyone? Because again, that's where the Shoemaker protocol shines to me, because I'm genetically susceptible. So that generic protocol of glutathione, charcoal, whatever, detox, ozone, didn't work for me. So do they really, do they specialize in their protocol looking at that genetically susceptible individual? That would be probably the number one defining question for me, if I were searching for a provider that could help me, is what do you do with the genetically susceptible individual? That answer will tell you everything.
Next question is, can you tell me what tests that you recommend, and are endotoxins and actinos more of a risk than mold?
So I don't think they're more of a risk than mold. I think endotoxins and actinos are just as important as mold and mycotoxins. I think it comes down to, those are all things that we know cause this immune activation. And so I think we need to, when we're speaking to a genetically susceptible individual and trying to treat to them with this specialized NCRSI protocol, we have to address all of it across the board. You can't just say, I'm going to clean up the mold, or I'm going to clean up the endotoxins, or I'm going to just clean up the actinos, because you don't know what they're responding to. Now, we do have some great not new, but we do have some testing available from the medical side of things, where we can look at what the genetic expression is of someone and what they are specifically reacting to. It's called a Gini test, and it looks at the active genetic expression that's going on in that individual at the time of the blood draw. And it's telling us what genes are being expressed as a result of their environment. And just overall what they're being exposed to. And so that gives us a lot of information. Now, it doesn't always give us the smoking gun, so to speak. I've done a fair amount of Gini tests where, I'm waiting to see what is their immune reactivity. Nothing. It doesn't pop up on anything. So, and it's like, wah, wah. But again, it's just not enough for the gene expression to pop off. So it doesn't mean that they're not reactive to anything. To me, that just is even more of a proof that you have to get control everything, the endos, the actinos, and the mold and mycotoxins.
Next
it's
question. This one's kind of like a toss between you and I, actually. Can an MRI of a brain really be helpful to tell the type of exposure? So I'll let you.
I'll let you. You're the landmark case girl, so you handle that one.
So yes, it's not going to be able to tell you the type of exposure, but what we can do, there is testing called a neurogauge, and it's conducted by Cortex Labs. And what it does is it measures the brain volume from the left to the right hemisphere. We are able, now that a lot of them have been conducted, we are able to see that certain parts of the brain atrophy and swell. And it's like a case study almost. And we're blessed that Dr. Ross, who actually sits on our medical advisory board, is kind of the forefront leader in that. And we are seeing now that, here we have the world of neuropsychiatry and brain, and that's parlaying over with a lot of our CIRS type doctors, Shoemaker type protocol, and those two worlds are merging together. So we're seeing other parts of the body that are affected. We are able to conclusively diagnose those things. And just to add one more thing, that has been proven in federal court. So that is a standard now that is kind of tried and true. We know that it has passed a dauber. So there are really cool things out there. But it's not just an MRI. It would be an MRI with a neurogauge layover, which is just a software imaging. It takes about 8 to 10 minutes at the very end of the MRI to conduct that. I will say this, because we do all know Dr. Ross pretty well. If you are looking into having a neurogauge, reach out to us at the Medical Advisory Board, even through Normie Pro. There's a certain way that has to be calculated and gauged for each different type. And I know that Dr. Ross likes it to be a specific way. So reach out to us if you do have any questions. Be happy to kind of give you a little bit of help and guidance in that. But go ahead, add to it, Allison. Tell us what you know on your side.
Yeah, no. So the NeuroQuant is great. So I think again, just like in environmental assessment, in medical assessment, you need multiple different tests. So not only are we looking at blood work, but I love to be able to look at an MRI too, a neuroquant of the brain, which is just an MRI without contrast of the brain. It's a volumetric analysis of the brain that tells us, just like what Shelley said, are there areas that have atrophied or shrunk? And are there areas that have swollen, gotten larger? And mold has a very specific pattern that presents itself in the brain when it's affected by biotoxins. So I think that's just another confirmation, and especially I think that is just it also really shows patients that they're not crazy, that there are volumetric changes in their brain as a result of their exposure or exposures. And it's just another way to validate you're not crazy. This is what's going on in your brain. So I think that's another important tool. And I think it's an important tool, not only just in the medical realm, but, you know, when it comes down to litigation, having, you know, an imaging study that proves this, along with like Dr. Ross as an expert witness to speak to, you know, what's going on in this patient, I think that's a nail in the coffin for the other side.
I concur.
Well, Shelley and Skip and Allison, I want to thank you guys so much. We're at the top of the hour, and so we normally try to shut it down so that everybody can go to bed. But anyway, I just want to thank you so much, Allison, not only for being part of our medical advisory board, but just for being here. It was just inspirational. And I'm going to invite you back. I would love to see part 2.
Yeah. Oh, I would love to. I think this is great. I really, you know, kind of like we discussed, I really want to start inviting medical professionals on here so that we can really start having a conversation and opening it up and everyone learning from one another.
Absolutely. That's exactly our goal. So thank you very much for being here. Skip, Shelley, thank you for carrying on. You did a great job tonight. I really appreciate it. Just a reminder, guys, before you go tonight, we've got 10 Protect Airs that I want to give away. You need to email Nathan. And by the way, I didn't say this, but I'm going to say it now. 1 per person, but you need to send him the pedigree information of the person that you want this unit shipped to. We do not want to ship it to you and have you sell it. How slick am I, Skip, or what?
That's a capital S slick.
And we're going to do that because we're going to reach out to the customer and let them know that we're sending them the unit. We'll tell them that it's as a result of your request, and we'll be more than happy to tell them to purchase more product from you. But we'll want a testimonial. We'll want them to tell us how it worked, and that'll help us promote our products to other folks. So let Nathan know who you want this sent to, and we'll reach out to them and get that to them right away. Guys, thank you so much for being here. It was a great
Thank
evening.
you, Allison. Thank you, Shelley.
Thank you, Allison.
Thank you.
Thank you.
Everybody have a great evening.
Thank you.